So one of the biggest gap in our country is monitoring. People don't want to monitor, or they don't understand the importance of monitoring. For a non-communicable disease, the only way to achieve a tight glycemic control is monitoring. If you are checking your sugar, you know that it is high, you would like to seek the opinion from the doctor, and then your therapy will be escalated. If I am not monitoring, I don't know what is my sugar because it does not cause me any symptoms. I may not go to the doctor and my treatment will not be escalated. They are not monitoring lab. They are not monitoring HbA1c, which should be done 3 monthly. They are not self-monitoring. They are not screening for the complication. Like people are not monitoring for their lipids, for blood pressure monitoring, for their kidney function, for their heart function. So actually a diabetic patient should be monitored for all those complications. Digitally monitoring was possible since last decade almost. But the thing is, during COVID time, one benefit is there. Now it had become more popular. People don't want to travel now. And still I can get connected with my doctor. I can digitally transfer my data to the doctor. I have app, I have such application, and I can talk on a digital platform. Like the way you and me are talking on this platform, like we are sitting across the table only. So in the similar way, a patient can consult the doctor. And now with the ICMR guideline, which is approved by ICMR about the teleconsultation. And diabetes is a one area where teleconsultation is very easy, at least for follow-up patients. So my patient who can't travel from 300 kilometers to me, at least he can get connected with my clinic the way whenever he wants to do it. So the doctor is also at comfort level. Patient is also at comfort level. So digital connection is possible. At the same time, digitally we can transfer the data also. These are the medication which what we do in our clinic, that again same, one of my assistant and associate will see it. Educator and dietitian will educate the patient. So this is what we do. So digital connectivity is very easy, and digitally you can transfer also. The other technology where I'm talking is the monitoring. So other than teleconsultation and mobile health applications which are available to us, I think the monitoring, which also changed a lot. Now we have monitoring device which is just checking the sugar, and all the data remain on your phone, and that data can be transferred to the doctor. And now we have come out with a concept of point in range. How many times you are checking your sugar, how many sugars which we are checking, they remain in the range between 80 to 180. So that's points in range. So between 70 to 180, if I'm checking my sugar 25 times in a week time, out of 25, how many of them are actually between 70 to 180? So whether I'm keeping a good control or not, I can see it if I have all 25 reports. The problem is patients are randomly, irregular monitoring. Important thing is structured monitoring. If you are just measuring the sugar randomly, it will not have any impact. If I am structurally monitoring and I am sending the data in that particular structure, my before breakfast, my after breakfast, my before lunch, my after lunch, my before dinner, my after dinner, my evening sugar, my after exercise, before exercise, early morning, midnight, that is what we call it in a structured way. The second is meaningful monitoring. So each and every patient should be empowered with a meaningful monitoring. My sugar is 400, then what I have to do? So nahi jana hai mere ko 400 sugar aane par. I have to act upon it. If my sugar is 40, I have to act on it. So that is what we call is meaningful monitoring. It means we have to empower the patient. Just by seeing a report of 400 or 40, you have to act on it, because your next report should be normal. If you don't know what to do, how you get connected with the clinic? So that is also digitally possible. Phone call, WhatsApp, message, whatever the way. And then what the treatment you should take also. So this will complete the ecosystem where a patient has to monitor. He has to be empowered. He has to have a structured monitoring. This data is to be transferred to the doctor. The doctor, while consulting, they will create a points, how many points in range you are in control. The therapy we have to understand, then escalation or de-escalation of therapy. Then again, nutritionist and educator will talk to you. And then finally, again, we have to go on doing the same thing, again, doing self-monitoring, again, sending the data to the doctor. This is how we have to get someone under good control. So one thing is, during this COVID time, there are data and multiple papers published that those who have uncontrolled diabetes or first time detected diabetes found to have worse outcome in compared to the who are well controlled diabetes or who are not diabetic. So one thing is clear, diabetes is a very important comorbidity. Particularly uncontrolled sugar is a very important comorbidity to decide the final outcome for acute infection like COVID. The second, there are multiple such papers also published that sugar monitoring is very, very important. And one such paper, which was published by Dr. Anup Mishra, Dr. Jyoti Dev, and myself, that sugar monitoring should be considered as a fifth vital sign. During COVID time, we all know that we started understanding the importance of oxygen saturation. Everybody started talking about oxygen saturation. So these are known as vital signs. Your temperature, your pulse rate, your respiratory rate, your blood pressure, they are vital signs. So the way you enter the hospital or you go to the doctor, doctor take your pulse, they take your blood pressure, they take your temperature, they take your respiratory rate or your oxygen saturation. So what we are talking, the similar way, a person's sugar should be also monitored. The way we are monitoring these data, the sugar monitoring is also very, very important. With diabetes, the idea came with the one is that worse outcome during the COVID time. Second, such type of papers which were published and written by us, and I am also part of that authorship list. And then we thought of that RSSDI as a primary body of diabetologist or doctor, but we should have some impact in the society or some social campaign we should start, that everyone, the way we are talking about our oxygen saturation, similar way everyone should talk about that my sugar is this. I am normal, I am not normal. If I am not normal, then I have to track my sugar regularly to keep myself normal, under control. If I am normal, then I should also understand that how I can remain normal. So what are the ways by which I can be prevented from the diabetes also? That is also my responsibility to understand. And this social campaign is primarily to increase the awareness about the sugar monitoring, testing, tracking, and treatment in the society. Education or awareness is a continuous process. It's not like that the government of India ने एक बार बोल दिया कि smoking बंद कर दो. It is injurious to health, or you have written already on the उसके पीछे लिखा दिया कि भाई smoking is not good for your health. But they are doing it continuously. It has to be done every day. So the similar way, a Defeat Diabetes campaign may end in 100 days. The campaign days are 100 days may be over, but that monitoring or education or awareness should be continued for all the year till we get diabetes free India. But one thing is, 2/3 of our diabetic patients have developed cardiac problem. So I always tell why we are treating diabetes, because we are preventive cardiologists. We don't want our patient to go to cardiologist's hand, and how we can prevent. So multiple cardiovascular risk factors are to be assessed by the doctor, and patient should follow to modify all those risk factors to prevent the cardiac problem. So it's not just the sugar, it's the blood pressure, it's the cholesterol, it is smoking cessation, it's morning walk, regular walk, your lipids are to be treated, abdomen exercise to be done, yoga is to be done. So multiple things. It's a holistic approach to prevent cardiovascular disease in our diabetic patients. I think more and more persons can join. It is not for the doctors only. Anyone can become a health champion. Primarily, the idea is to diabetes to be prevented, and a better control will lead to less complication in diabetic patients. So anyone, a person with diabetes, a caregiver, a relative, a friend, or anyone who is in this country, because we all want our patients or the persons with diabetes, that ratio should decrease. We should become more healthy. We should not have these premature coronary artery disease or the problems in our country. The kidney failure is increasing, and we are spending a lot of money for that. I mean, we are a poor country. So let us become more healthy. Let us become more aware about the conditions, and let us adopt healthy lifestyle.